Good day, my name is Edith Machowski. I am a senior scientist at the CPTB at Wits University, where we study both clinical aspects in the hospital of tuberculosis as well as basic microbiology science to investigate the organism that causes the disease. TB, of course, starts with a person who feels they are sick. They have the symptoms of coughing, of night sweat, of weight loss. So they go to the clinic, and they could have a different symptom, a symptom from a different disease like pneumonia. It takes the doctor and the clinic and the nurse to tell them, look, you've actually got TB, and this is how we need to treat it. And if you've got a different kind of lung disease, the treatment will be different. And because TB has such a long requirement for treatment, it is very often the patient does not adhere to the treatment. Also, in terms of by the time you've got symptoms, you will usually have quite a high load of bacteria because the disease can be dormant. So if you're not taking your medication either before or after you've been diagnosed, you're potentially running around making other people sick. If you're sick and the doctor has told you that you've got tuberculosis and he subscribes the medication to you, you have to take it every day. It's 4 tablets, and you start taking the medication regularly. You're a good patient, you adhere to the therapy, but once you start feeling better, many people stop taking the tablets because they think it's worked and the disease is gone, which is not the case. If you stop taking your medication, the disease is still there, and it's just at very low levels, so your body does not show the symptoms. The problem then becomes that the disease can come back in your own body, but you can also spread it to other people. Tuberculosis and COVID are two very different diseases that affect the lung. Tuberculosis has been around for millennia and has been making people sick for a very, very long time, whereas COVID is a recent phenomenon. Both of them are scary because they affect the lung. So with tuberculosis, however, it is a very established disease, and there are special clinics where you can go to get treatment. However, with COVID, because it has arisen so suddenly, and because the symptoms are so severe, the people really need much more dramatic intervention, which is where they come into the intensive care units. And the intensive care units are not set up to deal with so many people at once. You can't compare this to tuberculosis. In this side, tuberculosis is more tricky because of the length you can have the disease while it's dormant. So you can be actually infecting a lot more people because you don't know you've got the disease. And this is months and months. Whereas with COVID, you'll say, okay, there's a non-symptomatic carrier, but that's just a couple of days, maybe a week. So with TB, the whole thing is a lot more long-term and will take a lot longer to go away. However, we do have the antibiotics which you can use for a bacterium, whereas the COVID is a virus. It's actually called coronavirus. The CPTB works closely with the PHRU at Baragwanath Hospital, and they are a clinic who deal with HIV and tuberculosis. So we work closely with them in terms of they supply samples that we then help them analyze and We don't deal directly with the patients, but we do get samples and we test them in our BSL-3 facility. So this is a basic investigation as to how the bacteria can behave if they are given certain growth conditions. Our BSL-3 facility is highly regulated. It has negative pressure and it requires methods of waste disposal, and staff have to be highly trained before they can go in, because as a worker you have to make sure that you are not exposed to the organism that you're working. The CPTBR has two aspects to it. One is the clinical work that we've been doing together with the PHRU at Baragwanath Hospital. We also do basic research, which is investigating how the bacterium behaves as an organism outside of the patient. Because as a bacterium, it is alive and it can live by itself. And so we want to investigate aspects of the bacterium that are not known, and that can give us information as to how in the future we might be able to develop better antibiotics or better treatments, or answer questions that would be relevant to the basic biology.